Newly revised data from the nonpartisan Congressional Budget Office estimates that the House Republican tax bill making its way through Congress would take health coverage away from millions of people over the next decade. The bill includes roughly $715 billion in cuts from Medicaid in the coming years. It would leave nearly 11 million Americans uninsured. The bill also fails to extend subsidies that have greatly lowered the cost for those covered under the Affordable Care Act. The cuts, estimated to be about $335 billion over 10 years, would result in nearly 5 million more Americans losing their health insurance. In total, 16 million Americans stand to lose coverage over the next decade if the House bill is enacted as is. And I want to bring in Julie Rovner. She is the chief Washington correspondent for KFF Health News. So, Julie, thank you for joining us. The single largest source for savings, estimated to be about $280 billion, comes from a new requirement for Medicaid recipients to provide proof of employment. How will this work, and who will be impacted by it?
Well, of course, many of the people who are on Medicaid who are of working age, so between 18 and 64, will be required to report their work activities. Now, we know most people on Medicaid already work. It's not a matter of getting people who are doing nothing to get up and go to work. They may work at a job that doesn't provide health insurance. That's why they have Medicaid, or they may not work enough hours. What we've found in previous tests with Medicaid work requirements is that people tend to lose their coverage not because they don't work, but because they can't navigate the bureaucracy. They can't actually get through the reporting process that's required. So that's one of the reasons that the Congressional Budget Office estimates that many people will lose coverage. It's not that they're not working, it's that they won't be able to prove that they're working.
That's an interesting point to make. Now, what can you tell us about the impact of the budget bill on anyone who has health coverage through the Affordable Care Act?
You know, this is not the quote-unquote repeal and replace that we saw in 2017, but it takes a big chunk out of the Affordable Care Act, particularly people who buy their coverage through these exchanges. It's about 24 million people now. There are a number of provisions in the bill that make it more difficult to get that coverage. It will make that coverage more expensive. Plus, as you mentioned, the allowing to expire the additional subsidies that were added during COVID, that's going to result in a significant drop-off in people being able to get and being able to afford this coverage through the Affordable Care Act. So it isn't just Medicaid.
Yeah, such an important story impacting potentially so many people. Julie Rovner, we appreciate your time. Thank you so much.